Welcome to Successful Aging. During the next half hour, the LECOM Institute for Successful Aging will show you what it takes to live a long and healthy life, and what you need to know about treating and caring for those who are showing the average signs of aging. I'm Dr. James Lin, Director of LECOM Institute for Successful Aging. I'm a fellowship-trained geriatrician, which means I specialize in caring for seniors. The Institute for Successful Aging is located in the LECOM John M. and Sylvia Ferretti Medical Fitness and Wellness Center on Peach Street in Erie, Pennsylvania. Some Institute services are also offered at nearby Mill Creek Community Hospital and Mill Creek Manor. The LECOM Institute for Successful Aging was founded in 2008 to meet the needs of people who are over 50 years old, a population group that is increasing dramatically, especially in our region. Pennsylvania is second only to Florida among states with the highest percentage of people 65 and older. In fact, by 2050, 1 in 5 adults will be over 65. Our health system's mission has long been to meet specific community needs. From Mill Creek Community Hospital providing mental or behavioral health care when the community needed this resource, to its founding of the Lake Erie College of Osteopathic Medicine, or LECOM, to meet the need for more physicians. We established the LECOM Institute for Successful Aging to meet the growing need for primary care and clinical services in geriatric medicine across the entire continuum of care. We offer unique programs and services including comprehensive geriatric assessments, osteoporosis and geriatric fracture prevention clinics, memory assessments, mental health services, and many educational programs. For more information on any of our services, to make an appointment with a geriatric physician, or to schedule a geriatric assessment, call 814-868-7850 or visit lecomtotalhealth.com. The LECOM Institute for Successful Aging is truly a one-of-a-kind resource for comprehensive healthcare services designed just for seniors. Our mission is to not only add years to your life, but life to your years. So please, stay tuned as we show you how we can help you achieve that. Next, we'll talk to Dr. Danielle Hansen, a fellowship-trained geriatrician who will discuss prevention and early detection of health problems. Dr. Anthony Ferretti, an orthopedic surgeon who will explain treatments to help seniors maintain their mobility and independence. Dr. Blake Hoppy, a neurologist who diagnoses and then treats problems such as memory loss or difficulties with balance. And Dr. Max Gottesman, a psychiatrist at Mill Creek Community Hospital who talks about the specialized staff and services of the Senior Behavioral Health Care Unit. We'll also answer health-related questions that seniors in our area have asked.
I'm Dr. Danielle Hansen, a fellowship-trained geriatrician. My office is here at the LECOM Institute for Successful Aging, located in the LECOM Medical Fitness and Wellness Center. As the number of seniors dramatically increases with the aging baby boomer generation, it is essential that healthcare professionals are prepared to navigate the challenges faced by aging America. A geriatrician is a physician who specializes in the care of older adults. The complex problems associated with aging demand this specialized training. Fellowship training in geriatric medicine requires 1 additional year of education following a 3-year internal medicine or family medicine residency. Anyone over the age of 50 should consider having a geriatrician as his or her primary care physician or as a consulting physician who collaborates with his or her primary care physician. To find a geriatrician or another physician, you can visit the website maerie.org. These doctors also teach at LECOM, the nation's largest medical school, which is headquartered here in Erie. One service provided at the Institute for Successful Aging is comprehensive geriatric assessments. This involves a complete history and physical examination, including a mental health evaluation and screening for other geriatric syndromes. Geriatric syndromes usually have more than one cause and involve different body systems, resulting in impaired functioning and quality of life. Examples of these include vision and hearing problems, falls, urinary incontinence, nutritional deficiency, adverse effects from medications, and confusion. Geriatric syndromes can limit older adults' ability to perform daily tasks and threaten independence. It is the job of a geriatrician to detect these problems and intervene to improve them and in turn improve quality of life. A senior or their family member should consider a geriatric assessment if they have complex medical issues or problems with memory, mood, balance, bladder control, eating, thinning bones, sleep, or simply aren't as functional as they think they should or could be. Just as you would bring a baby or a young child to a pediatrician, you should bring an older adult to a geriatrician. For more information on geriatric assessments or to schedule one, just call 868-7850. At the LECOM Institute for Successful Aging, we have the latest training and diagnostic technology to assess whether health problems are physical or mental in nature and how to best treat them. Diagnostic tests are performed to monitor the health of our patients, so any problems are detected early on. The latest technology and equipment, including mammography, X-ray, CT scan, sonography, bone densitometry, are available here at the Outpatient Imaging Center, also located in the LECOM Medical Fitness and Wellness Center. The Imaging Center is conveniently located across the hall from the Institute, so imaging studies for our patients can be obtained whenever we need them, and the results are available for review. If you're a senior patient of any of the physicians affiliated with Medical Associates of Erie, we'll provide free transportation to and from your outpatient tests and appointments. All you have to do is schedule transportation through your physician's office. The team of healthcare professionals at the LECOM Institute for Successful Aging strives to improve the health, function, and quality of life for our patients. In geriatric medicine, we may not be able to cure all of the various disease processes that inflict our patients, but we are able to improve the impact they have and to heal them.
Thanks, Dr. Hansen. Many seniors exercise here at the region's largest and most comprehensive fitness facility. There are 3 pools for general or therapeutic exercise for individuals or groups. There's a walking or running track, treadmills which you can use while watching TV, various weightlifting equipment, plus spacious new locker facilities with individual showers, a whirlpool, sauna, and steam room. Now we'll answer a question from a local viewer and then return to Successful Aging.
One local senior asks, I have arthritis in one hip that sometimes bothers me enough that I think a walker would help me get around better. My only insurance is Medicare. Will it cover a walker? And if so, where should I get one? The answer to the first question is generally yes. Medicare Part B covers home medical equipment. Every item billed to Medicare, however, requires a physician's order or a special form called a Certificate of Medical Necessity, CMN, and sometimes additional documentation. As far as where you should get a walker, one home medical equipment supplier that is affiliated with LECOM and Mill Creek Community Hospital is Vantage Home Medical Equipment and Services. 3 of the Vantage Home Medical stores are located at 2741 West 21st Street in Erie and in Meadville at 19049 Park Avenue Plaza and 1034 Grove Street. For more information, call 814-337-0000 or toll free at 800-548-5463.
If you're 50 or older, a new team of medical experts can help you add not just years to your life, but life to your years. Choose specialists from Medical Associates of Erie. Receive transitional care for seniors at Mill Creek Community Hospital. And get a geriatric assessment for physical and mental health at LECOM's new Institute for Successful Aging. If you're over 50, you're ready for a lifestyle change. You need more than conventional health care. You need total health care for a lifetime.
People have their own ideas about miracles. Some will tell you miracles are irrefutable signs of divinity. Others will say they're nothing more than myth. But one thing cannot be denied. When mind, body, and spirit work together, truly together, the impossible becomes suddenly possible. This is what we teach at LECOM. This is a calling that we can help you fulfill. LECOM, can you hear the calling?
Welcome back to Successful Aging. Another resource available to seniors and other patients within the Wellness Center is our physical therapy facility called the Center for Successful Living. The center is unique in that we offer both conventional and aquatic therapy with 3 pools plus access to all of the exercise equipment in the LECOM Medical Fitness and Wellness Center. For seniors following joint replacement, for example, our staff provides post-surgical rehabilitation therapy. We also provide physical therapy for arthritic conditions as well as preventative therapy to help seniors avoid surgery. Some patients may require more advanced treatment than physical therapy to get back on their feet or to regain full mobility. We'll talk now with Dr. Anthony Ferretti, an orthopedic surgeon who performs joint replacements and other procedures. Dr. Ferretti has his office here at the Institute on the 3rd floor of the LECOM Medical Fitness and Wellness Center.
Maintaining mobility is a key factor for enjoying maximum independence and quality of life. Some procedures that ease the pain of arthritis, for example, are quite simple. We inject arthritic joints with a steroid or visco supplement, which is a quick procedure that can provide immediate and lasting relief. For the unfortunate seniors who fall, we also repair fractures of the extremities, such as hips, ankles, wrists, and elbows. Hip and knee replacement surgery is becoming more common as well. The technology is as good as it's ever been, and the older population that requires them is staying more active. So they are giving joint replacement more consideration. If you want more information on joint replacement or other procedures that can help restore your mobility, just call our office at 868-7840 or talk to your family physician about getting an evaluation by an orthopedic surgeon. We've had patients who've had hip and knee replacements return to swimming on a regular basis, or even hunting and bowling or taking vacations, things they hadn't been doing in a long while. One woman couldn't walk from her car to my office without great difficulty. Following a knee replacement at age 75, she went out and got a part-time job. I enjoy working with older patients. It's definitely one of the best parts of my practice. I enjoy interacting with people who are eager to make progress, who are not satisfied with a painful hip or knee or laying on the couch. And older patients have a real need. They don't complain, they're great at following instructions, they work hard in therapy, so I'm as anxious for them to get better as they are. They are a pleasure to take care of.
Thanks, Dr. Ferretti. As Dr. Ferretti mentioned, joint replacement is a viable option for many seniors who want to improve their mobility and maintain their independence. An advantage of having joint replacement surgery performed here at Mill Creek Community Hospital is that we have geriatricians who are specially trained to meet the needs of the senior patients. After surgery, older patients can be cared for in our unique ACE unit, which is designed to provide acute care for the elderly patient. To complete the continuum of care, we also have a transitional care unit to provide extra services and time that senior patients may need before they return home. Another advantage is the continuity of care we provide. The doctors who provide your primary care or perform your surgery are also your caregivers in ACE or transitional care unit. These units are located in Mill Creek Community Hospital and are among many new services now available at the hospital. We'll be back after this break to explain more about resources that are available to you through the LECOM Institute for Successful Aging.
Another question from a senior. I know there are fitness centers for adults in general, but are there programs or exercise classes just for seniors? The answer is yes. There are many local exercise programs and classes designed for seniors. The ones affiliated with the LECOM Institute for Successful Aging are available at the LECOM Medical Fitness and Wellness Center, 5401 Peach Street in Erie. Arthritic Aqua and Easy Moves are 2 of the aquatic exercise classes currently being offered there. Senior Fitness is another class designed with the mature exerciser in mind. For more information on LECOM Medical Fitness and Wellness Center, visit www.lecomwellness.com. That website once again is www.lecomwellness.com. Or you can call 868-7800. That number once again is 868-7800.
There are many independent regional hospitals sharing resources to better serve you, such as Mill Creek Community Hospital. Mill Creek founded LECOM to meet a need for more physicians. Today it meets community needs for senior services provided by orthopedic surgeons and geriatric physicians found at maerie.org. Mill Creek Community Hospital is also the region's largest provider of behavioral health care with senior, adult, and adolescent units. Mill Creek Community Hospital, a proud member of Vantage.
Experience wellness like never before at the LECOM Medical Fitness and Wellness Center. Our team of health professionals will transform the way you view health and wellness. From a personalized fitness assessment, an exercise prescription to expert personal trainers, spa professionals, and our Healthy Foods Cafe. It's more than a place to work out. It's a one-stop destination for preventative health and wellness. To learn more, call 814-868-7800 or visit us online at lecomwellness.com.
While difficulties with walking can be caused by arthritic joints, many seniors experience problems with balance, problems that can have neurological causes. Let's hear next from Dr. Blake Hoppe, a neurologist who has offices here and who performs neurological evaluations to help determine and treat health problems of the elderly.
If a patient has a neurologic condition such as memory loss or balance problems, then I perform a full neurological evaluation. Neurology encompasses the study of the brain, spinal cord, nerves, and muscles. A neurologic examination consists of testing mental status, speech, cranial nerve function, muscle strength, reflexes, sensation, coordination, and gait, or walking. Some common disorders that I see are dementia, multiple sclerosis, epilepsy, stroke, migraine, Parkinson's disease, spinal cord problems, and peripheral neuropathy. In the office, I perform EMGs, or electromyograms. This test involves sending electrical impulses to arms and legs and inserting a needle into muscles to diagnose nerve or muscle disorders, such as carpal tunnel or other peripheral neuropathies. Other tests, such as MRIs, are performed at Mill Creek Community Hospital. I enjoy working in collaboration with our geriatricians, Dr. Lynn and Dr. Hansen, to better diagnose and treat our aging patients. Memory loss experienced by seniors can often be related to other physical health issues or perhaps caused by too many medications or their interactions. We have a pharmacologist here at our institute, Dr. Rachel Ogden, to help review medications. At our office, we also have a speech pathologist, Nanette Crawford, who provides cognitive therapy and communication therapy to help patients with memory problems. She also performs swallow evaluations for patients that have swallowing difficulties. So, who should consider a geriatric assessment or a neurologic evaluation? Anyone who is not satisfied with how they are functioning in general or specifically as far as balance or memory. All they have to do is call the LECOM Institute for Successful Aging at 868-7850.
Thanks, Dr. Hoppe. Now we'll take a short break before exploring resources to help seniors maintain their best possible mental health.
Here is a question several seniors have asked. What exactly is osteopathic medicine, and how do doctors with a DO after his or her name differ from those who have an MD? Osteopathic medicine employs a whole-person approach to medicine to treat the person, not just the symptoms, and it emphasizes health education, injury, and disease prevention. Doctors of osteopathic medicine, DOs, and doctors of allopathic medicine, MDs, both complete 4 years of medical school. Both are fully licensed to prescribe medication, perform surgery, and after residency training, practice in all other specialties. DOs receive extra training in the musculoskeletal system and integrate osteopathic manipulative treatment into their practices. Erie is the home of Lake Erie College of Osteopathic Medicine, currently the nation's largest medical school among all osteopathic and allopathic schools. Visit www.lecom.edu for more details.
Mastering any instrument takes precision, determination, and a lifelong commitment. Internal medicine specialists Dr. Garrett Clark and Ron Barrick not only apply these traits to their music, but also to their practice of medicine. 2 doctors, 1 practice. A lifelong dedication to you, Medical Associates of Erie. Total health care for a lifetime.
An expanded team of medical experts, including physicians, psychologists, nurses, and therapists, cares for people suffering from mental and behavioral health problems. This immediate and comprehensive care is provided at Mill Creek Community Hospital, the region's leading behavioral health care facility, with special care units for adolescents, adults, and seniors. For good mental health at any age, You need total health care for a lifetime.
Another resource of the LECOM Institute for Successful Aging is Mill Creek Manor, a skilled nursing facility that adjoins Mill Creek Community Hospital. The advantage of patients at Manor is that they have 24-hour access to any medical services of the hospital and 24-hour access to physician care. Skilled nursing care is one more component of our complete continuum of care for seniors, a continuum that is not offered anywhere else in northwestern Pennsylvania or tri-state area. Hopefully, I have now covered all aspects of what the LECOM Institute for Successful Aging can offer to seniors. Geriatric primary care, orthopedic and neurological services, diagnostic testing at the Outpatient Imaging Center, physical therapy at the Center for Successful Living, specialized inpatient senior care, fitness center facilities, skilled nursing care, educational programs, even transportation for physician appointments. We are proud to present these physicians, facilities, and services designed just for seniors. We hope you'll consider them and benefit from them as they are intended, as a resource for aging successfully. Thank you.
One of the best ways to access any of the total health care services is to choose a physician affiliated with Medical Associates of Erie. MAE physicians practice medicine in offices throughout Erie County and also teach at Lake Erie College of Osteopathic Medicine. Here are Medical Associates of Erie physicians and their office locations. Dr. Ronald Balderak, Dr. Michaelyn Bainey, Dr. Ranko Barak, Dr. David Beaton, Dr. David Badowski, Dr. Sarah Breon, Dr. Ravi Chekka, Dr. Garrett Clark, Dr. Gregory Coppola, Dr. Carlo DeMarco, Dr. Anthony Ferretti, Dr. David Fox, Dr. Kim Gaughan, Dr. Douglas Greiser, Dr. D. Gowanzon, Dr. Paula Gundas, Dr. Stephen Habusta, Dr. Danielle Hansen, Dr. Jan Hendricks, Dr. Blake Hoppy, Dr. Jeffrey Iannero, Dr. Paul Kohut, Dr. Patrick Leary, Dr. James Lynn, Dr. Eric Miley, Dr. Steve O'Donnell, Dr. Gary Peterson, Dr. William Phelps, Dr. Beth Ann Callahan Ritchie, Dr. Armando Ritchie, Dr. Richard Sposito, Dr. Frank Tercy, Thank you for watching Successful Aging, brought to you by the LECOM Institute for Successful Aging and produced in conjunction with WSCE TV.
If you're 50 or older, a new team of medical experts can help you add not just years to your life, but life to your years. Choose specialists from Medical Associates of Erie. Receive transitional care for seniors at Mill Creek Community Hospital. And get a geriatric assessment for physical and mental health at LECOM's new Institute for Successful Aging. If you're over 50, you're ready for a lifestyle change. You need more than conventional health care. You need total health care for a lifetime.